Welcome to the VICToRY Study Pharmacy Procedures Training Module. We will begin with a brief description of the study. This is a study of vitamin C in thermal injury, the VICToRY trial. The study is sponsored by Dr. Darren Hyland, Critical Care Department, Queen's University, Kingston, Ontario, Canada. He is also one of the 3 principal investigators, along with Dr. Christian Stoppe, Anesthesiology, Würzburg University, Würzburg, Germany, and Dr. Leopoldo Cancio, Director, U.S. Army Burns Center, Fort Sam Houston, Texas. I am Maureen Dansero, the project leader for this study. This is a double-blind, randomized controlled trial of high-dose intravenous vitamin C versus placebo. We intend to enroll 666 adult patients, 18 years of age or older, with deep second and/or third degree burns, of which at least a portion will require skin grafting, and with a total body surface area burn of 20% or greater. The overall aim of the VICToRY study is to reduce the burden of illness associated with significant burn injury using a naturally occurring substance, vitamin C. This slide provides a pictorial overview of the study from the time your patient is admitted to your hospital until 6 months post-admission. As soon as the patient is admitted to your hospital, ICU, or burn unit, they should be assessed immediately for inclusion in the VICToRY study. Consent should be obtained and the patient randomized. Under ideal circumstances, the patient should receive their first dose of investigational product within 3 to 6 hours of being admitted. Minimally, the patient must be assessed for inclusion in the study within 24 hours of admission. Once the first dose of study product has been administered, the patient will continue to receive doses every 6 hours for 4 days. We will then monitor the patient closely for an additional 3 days after the last dose has been received. And as long as the patient remains in the ICU or burn unit, we will collect data until 3 months. At 6 months post-admission, we will assess the patient's quality of life by administering several questionnaires. Now we will look at the investigational products for this study and review the pharmacy procedures. The active investigational product for this study is injectable vitamin C, and the control or placebo is D5W or normal saline. The Sero project leader and team will work with the pharmacy team at each participating site to set up procurement of injectable vitamin C and establish payment or reimbursement. This will vary from region to region. Sites are responsible for maintaining an adequate supply of injectable vitamin C, as well as an adequate supply of D5W or normal saline to be used as diluent, as well as to be used as placebo or control. This should be in the form of 50 ml or 100 ml IV mini bags. For this study, you will need an unblinded study team member for investigational product accountability, preparation, and dispensing. If this is not a pharmacist, pharmacy assistant, or pharmacy team member, it should be a team member with clinical training, such as a nurse or doctor. Please discuss the use of non-pharmacy team members with the project leader. Product storage and temperature monitoring are vital. Different injectable vitamin C products will be used in different regions, dependent upon regulatory approvals and availability. Prior to dilution, products must be stored in accordance with the product monograph. Be sure to familiarize yourself with the product that you are using. Once prepared, the vitamin C solution must be stored 2 to 8 degrees Celsius and protected from light. The temperature where the solution is being stored must be documented daily. If the area where the IP solution is being stored is already monitored and documented, there is no need for duplicate documentation. If the temperature is not being documented in the area where either the injectable vitamin C or the prepared vitamin C solution is being stored at your site, please use the sample temperature log that we provide. Make sure that you insert your site name, site number, the name of the product that you are using and the manufacturer, and the required storage conditions. Be sure also to record the temperature daily and indicate which month and year you are recording that temperature for. Any excursions should be reported to the project leader. When preparing the injectable vitamin C for administration, please use hospital-supplied D5W or normal saline as diluent in the form of IV mini bags. The investigational product preparation should occur using aseptic technique. Please follow local procedures for aseptic preparation of intravenous medications. At some sites, this will involve use of a laminar flow hood or isolator. Once prepared, the solution should be clear and colorless with no visible precipitates. Protect the prepared solution from light by placing the IV bag inside a light impermeable container or a light protective bag. If using light protective bags, label both the IV bag and the light protective bag with the patient label and orders. Store from 2 to 8 degrees Celsius and keep protected from light until administration. In the event the research pharmacy or delegate will not be available, vitamin C doses may be prepared in advance and, per stability testing, are stable for 14 days under refrigeration and protected from light. Weekend and holiday doses may be prepared in advance and stored from 2 to 8 degrees Celsius and protected from light in a location that is accessible to the nursing staff who will be administering the IP. If the weekend or holiday extends 3 or more days, such as Saturday, Sunday, and Monday, sufficient doses to cover the entire treatment period will be prepared on the last day prior to the weekend or holiday. In the example of a long weekend, as noted above, the additional doses will be prepared on Friday. The investigational product dose in this study is vitamin C, 200 milligrams per kilogram per day, in divided doses, administered every 6 hours for up to 96 hours, 4 days, 16 doses, or until hospital discharge. Patients who weigh more than 150 kilograms will be dosed based on a weight of 150 kilograms, so the maximum daily dose will be 30,000 milligrams and the maximum single dose 7,500 milligrams. The total daily dose, milligrams per day, and single dose, milligrams per dose, will be calculated by the central randomization system. Additional calculations will need to be done by the pharmacy or unblinded delegate who is preparing the investigational product solution. Vitamin C will be diluted in D5W or normal saline to a concentration of 36 milligrams per mil to 92 milligrams per mil inclusive. The infusion rate must be equal to or less than 100 milligrams per minute. Preparing doses for patients who weigh less than 50 kilograms may require withdrawal and disposal of solution from the mini bag prior to injecting vitamin C into the bag to ensure a concentration of 36 to 92 milligrams per milliliter. In the example below, we use a product concentration of 500 milligrams per milliliter. We do not account for mini bag overfill in the examples that follow. A 35 kilogram patient receiving 200 milligrams per kilogram per day will have a total daily dose of 7,000 milligrams. Divided into 4 doses is 1,750 milligrams per dose. To obtain a dose of 1,750 milligrams using a product with a concentration of 500 milligrams per milliliter, we will need to add 3.5 milliliters to a 50 milliliter mini bag. That will then give us a total volume of 53.5 milliliters. Dividing the 1,750 milligrams of vitamin C into the 53.5 milliliters tells us we have a concentration of 32.7 milligrams per milliliter, which is below the 36 milligrams per milliliter minimum we are trying to obtain. If we remove 20 milliliters from the 50 ml mini bag prior to adding the vitamin C, that leaves us with 30 milliliters in the mini bag. We then add the 3.5 milliliters of vitamin C, and that gives us a total volume of 33.5 milliliters. Now, when we do the calculation, we find our concentration is 52.2 milligrams per milliliter within the acceptable range. To ensure a final concentration of 36 to 92 milligrams per milliliter, when preparing doses for patients weighing less than 50 kilograms, the following is recommended. For patients weighing 40 to less than 50 kilograms, withdraw and discard 10 milliliters from a 50 milliliter mini bag. For patients weighing less than 40 kilograms, withdraw and discard 20 milliliters from a 50 milliliter mini bag. Calculations will vary when using different vitamin C concentrations or different sized IV bags. Each site is responsible for ensuring a final vitamin C concentration of 36 to 92 milligrams per milliliter is attained. If it is your practice to account for mini bag overfill, please follow your local practice. Ensure your process is clearly documented. The vitamin C infusion rate must be equal to or less than 100 milligrams per minute. The pharmacy team member or unblinded delegate who has prepared the vitamin C to ensure a concentration of 36 to 92 milligrams per ml is also responsible for providing the following information on the label for the prepared IV solution. Number 1, the final volume, the total milliliters in the bag of the prepared solution. And secondly, the minimum infusion time to ensure a rate of equal to or less than 100 milligrams per minute. One option for infusion time is to use ranges. For example, for doses that are equal to or less than 6,000 milligrams, infuse the IV solution over 60 minutes. For doses that are greater than 6,000 milligrams up to 7,500 milligrams, infuse the IV solution over 75 minutes. The maximum single dose will never exceed 7,500 milligrams. Investigational product dispensed for administration to study participants should be clearly labeled as in the context of a research study. Start with the study identification. This is the VICToRY trial. The name of the site investigator. The product name. which should read ascorbic acid or placebo, normal saline or D5W. The participant name or initials per your local standards, the date the investigational product was prepared and an expiration date, the storage conditions. All prepared vitamin C solutions should be stored 2 to 8 degrees Celsius and protected from light. That this is for intravenous administration, the total volume in the bag in milliliters, and the minimum infusion time. To maintain the study blind, placebo or control bags should be prepared so they are indistinguishable from active treatment vitamin C bags. Placebo bag volume should be similar to what it would be if the patient was randomized to vitamin C. The bag volume could reveal the treatment arm. In the example of our 35 kilogram patient, you would withdraw solution from the placebo bag to a final volume of 33.5 milliliters. Placebo bags should be refrigerated if vitamin C is prepared in advance and dispensed after being refrigerated. If using light protective bags for the vitamin C, use light protective bags for the placebo as well. We will now discuss how to access and use the central randomization system. Central Randomization System, or CRS access, is requested by completing the Excel spreadsheet that we send to you with the name, email address, and study role of each team member who needs CRS access. Pharmacy team members may choose to have one shared username and password. Any other team members need to have their own CRS login and should not share. Once the Excel sheet is completed with the name and email address of each individual who needs access to the CRS and their role, please email that to the project leader at maureen.dansereau@queensu.ca. If you worked with us on the Reenergize study and had CRS access, your login for VICTory will be the same. If you did not have access to the CRS for Reenergize, you will receive an email with your username and a temporary password. You will need to change your password the first time you log in. Multi-factor authentication, MFA, is required the first time you log in and every 30 days thereafter. The CRS is accessed at the URL displayed at the bottom of this slide. A multi-factor authentication code will be sent to the email you provided on the Excel sheet when requesting access to the CRS. For new accounts, you will need to create your password and log in. You will then be asked for your MFA code. During this process, you will receive 2 MFA code emails. Please use the code that you receive in the second email. Below is an example of the email that you will receive. Again, please use the code that you receive in the second email. Enter the MFA code sent to your email into the CRS where indicated. The MFA code for the CRS will expire every 30 days, and you will receive an email with a new MFA code to enter. Once you have entered your MFA code into the CRS, you will receive a message confirming your success. You will then be redirected to the login screen to re-enter your username and password. After you log into the CRS successfully, you will see a list of studies you are participating in with CIRU using the CRS. Click on VICTory. Pharmacy access to the CRS will provide treatment assignment and dose. A table will display the randomization number for each patient, randomization date and time, pre-burn dry weight as entered by the research team, the study treatment, whether it's 200 milligrams per kilo per day, vitamin C, or placebo, the total daily dose, and single dose in milligrams per dose. When checking the treatment allocation for a patient, confirm the randomization number against the number provided to you by the research coordinator. Newly randomized patients will appear in the last row on the bottom of the table. Maintain an individual record of the treatment allocation and dose for each patient. In the table, to print a single patient, check the box next to the randomization number of the patient you wish to print. You may print and sign physically or electronically, but you must maintain documentation that the treatment allocation and dose for each patient was confirmed. Treatment allocation and dose must be verified and signed by 2 pharmacy team members or delegates. Whether electronic or physical, maintain this document with your other study files. There must be an order for the study product signed by the site investigator or sub-investigator. The order should clearly state the VICTory trial, vitamin C versus placebo. The order, the patient weight, when the first dose should be administered, that open label vitamin C for the purpose of nutrient repletion may not exceed 200 milligrams per day intravenous or 1,500 milligrams per day oral. The storage conditions of the prepared solution, and how long the product should be administered, for 16 doses or until hospital discharge, whichever comes first. If the patient is receiving insulin, the insulin rate should be adjusted in accordance with results from the core lab or results from the study-provided glucometer. To ensure the patient receives the first dose of study product as quickly as possible, as soon as the patient is randomized, the research coordinator will contact the pharmacy or delegate. The coordinator will provide the patient randomization number. Pharmacy team member or delegate will access the CRS, view the treatment allocation, prepare the solution, and dispense the initial dose. The IP will be dispensed in mini bags and hung and administered bedside by the clinical staff. To ensure the first dose of study intervention is administered in a timely manner, we are requesting vitamin C doses and placebo bags be prepared in advance and stored in a location that is accessible to the research team 24 hours a day, 7 days a week. This will prevent delays due to pharmacy team or delegate not being available to prepare the initial dose or doses at the time of randomization, which may be in the middle of the night, in the evening, or on weekends. We understand and have heard from some of you that this may not be permitted in your country or region. Please follow national, regional, and local regulations related to advanced preparation of intravenous vitamins or medications for use in a research study. If advanced preparation is permitted and approved, please follow the steps in the subsequent slides. Per stability testing, vitamin C doses may be prepared in advance and are stable for 14 days, protected from light, and refrigerated at a concentration of 36 to 92 milligrams per milliliter. Advanced doses will be prepared using a patient weight of 110 kilograms. Note, both vitamin C and placebo bags need to be prepared in advance. Prepared bags must be stored refrigerated from 2 to 8 degrees Celsius and protected from light. The bags must be stored in a secure location accessible by the research and investigational product administration teams. The prepared product expiration, 14 days from preparation, must be clearly displayed on each bag. Pre-prepared first doses may be used on or off normal business hours. Vitamin C and placebo bags will be placed in separate containers and labeled with a code that can be clearly communicated to the study team over the phone, such as A and B. Only the unblinded pharmacy team members will know which product is in each of the 2 containers. To ensure continued blinding of the research team, the unblinded pharmacy team should periodically rotate the study products and allocate new labels. The pharmacy team must maintain detailed records of what is in each container and the associated labels at all times. After the patient is randomized, the study team member will contact pharmacy and request the pharmacy team member access the CRS. The study and pharmacy team members will verify together the following information: the patient randomization number, the date and time the patient was randomized, the patient's pre-burn dry weight as it's been entered into the CRS. Having accessed the CRS, the pharmacy team member will determine the treatment allocation and then instruct the study team member of the following: from which container to retrieve a bag for administration to the patient, total volume of the pre-prepared bag to be infused based on the patient's pre-burn dry weight, and the minimum infusion time or infusion rate to ensure a rate equal to or less than 100 milligrams per minute. The research team will verify the following with the pharmacy team member: the expiration date documented on the bag and the container from which the bag was taken. Please note, for patients with a pre-burn dry weight of greater than 110 kilograms, it is not necessary to infuse more than 1 bag as the initial dose. Record the initial dose as a one-time order. Prepare subsequent doses per the patient's pre-burn dry weight. There is no need to make up for this dose shortage. The pharmacy team member must document the following on the pharmacy randomization confirmation: the container from which the team was instructed to take the bag, the total volume to be infused that was communicated to the team, the minimum infusion time that was communicated to the research team. The research team member must document the following on the patient randomization confirmation: the container from which the bag was taken, the total volume to be infused that was communicated to them, and the minimum infusion time that was communicated to them. When the investigational product is being administered, it does not need to be stopped for procedures or surgery. Whenever possible, the investigational product should be continued as scheduled. In the event of an interruption or missed dose, Please work to make up the missed dose or doses as soon as possible after the dose is missed. When administering makeup doses, do not administer them with scheduled doses. Do not administer double doses. You need to leave at least 1 hour between the end of one administration and the start of the next. You may delay the start of the next scheduled dose in order to accommodate a makeup dose. Just remember to leave at least 1 hour between the end of one administration and the start of the next. It is vital that all doses of the investigational product are administered. Please do everything you can to make up any missed doses. Regarding investigational product dosing and changes, the investigational product is based on the patient's preburn dry weight. Patients will remain on the initially calculated dose of investigational product for the duration of the study. Since the treatment period is only 4 days, 96 hours, it is unlikely that the patient's true weight will significantly change during that time. There is no need to adjust the investigational product dose during the treatment period. We have provided investigational product dispensing logs on which to record the IP that is dispensed. If you would like to use your own log, please forward a copy of that log to the project leader for review and approval. Investigational product accountability logs have been provided for use with this study. If you prefer to use your own in-house accountability logs, please send a copy of the logs to the project leader for review and approval. Please follow local standard procedures for disposal of both unused investigational product and empty bags after the investigational product has been administered. This concludes the pharmacy procedures training module for the VICTory trial. Please forward any questions you have to the project leader via email. Thank you.